We have two guests in studio today, Debbie Klintworth and John Kuhlmann. Why Debbie Klintworth is using the GigCare program and why associations are adopting it. And John Kuhlmann's going to talk about that and all the associations he works with. You're a small business, you're an association member, maybe you're a director, you want to listen to this show. Stay tuned, listen, and learn.
And now, America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. You have a question or comment, send it to me. I get a lot of emails. I answer each and every one of them. You can also find these shows on our 16 podcast platforms like iHeart, Spotify, and Rumble. That's just 3 of the 16. And our YouTube channel, which is America's Healthcare Advocate, where we've got about 608,000 views right now between that and the podcast platform. And that's because of all of you out there in the listening audience. So we're very happy about that. Want to thank all of you for that. All right, in studio today, we're going to do something a little different. We have guests in here today, and we're going to be talking about the United Appliance Servicers Association. And you may be asking, what has that got to do with healthcare? Well, we're going to be talking about GigCare and how GigCare works for 1099 employees. And in studio with me today, I have Debbie Klintworth, and she is the CEO of Sloan Appliance in Carolina, or D3S Appliance Services in Texas, with 2 companies. Welcome. Very happy to have you here today.
Thank you so much for having me.
And we've got an old veteran in here with us today. John Kuhlmann's back for another show. So welcome back, John.
Thanks,
Out of Kuhlmann Group, we're happy to have you on board. And by the way, speaking of radio affiliates, we have a brand new affiliate in Manchester, New Hampshire, WFEAAM, one of our brand new affiliates in Manchester, New Hampshire. We're on there from 7 in the morning till 8 in the morning. We want to welcome them to the family, and we're very happy to have them on board. So thank you all so much. So, let me just start out with appliance repair. This is really kind of interesting. So I live in a house that's 3 years old. We just built it. I bet you I've had an appliance repairman out to that house no less than 10 or 11 times. So we had the wine refrigerator go. We had the ovens where the temperature wasn't right. We had the hood section that wasn't working. We had the heat lamp outside that kept going off that we couldn't get on. And luckily for us, every one of these people from these different companies that we called have sent out quality people. They did a great job. They're very polite, and they fixed it. So, like I always tell my wife, I can fix anything. All I need to do is get on the phone. Okay. So having a group in here like these folks today, United Appliance Servicers Association, and Debbie in here, who owns 2 companies that belong to this association. First of all, just talk about the association for a few minutes. And this is the last thing I would have ever thought of. There was actually an association of appliance repair people, but it makes perfect sense. So talk a little bit about that and why you are in that and a lot of other people with companies like yours.
Absolutely. We have been around for about 36 or 37 years as an organization.
Wow.
It started to actually level up the playing field for all of the companies so that we could become more professional. A lot of the people that do appliance repair know how to fix appliances, but they don't know how to run a business. And so it was to bridge that gap so that you won't see that you see a professional image from the outside looking in. And so this organization was started to bring each company up to teach them what they don't know, because you don't know what you don't know until it's really bad. And so we bring it all together. We talk, we network, and we work with the manufacturers, GE, Electrolux, Bosch, LG, all of them come to the conference. They give training.
Really?
Yes.
Okay, that's
so we partner with them.
So, quick story. We had a mix-it valve that our builder put in our shower, and it happens to be a Delta valve, but it's made in Germany. The most, I'm like, okay, for real?
Yes.
Well, when the repair people came to change it out, they wouldn't send it to them because it had to come to us because we were the client. So they gave us the information. I called Delta. They're very nice. They sent the thing out, and we got it. But I was like, for real? And there are only certain people in that company. There's one guy that understands how to put that thing in. And so, yeah. So so the training piece to me sounds like that's a pretty big deal, because these things are constantly changing in today's world. You know, what a television did 10 years ago, 5 years ago, is not what the televisions I have in my house do now. It just so you're constantly updating them, and so the companies are actually working in conjunction with you, so they know the best technology and the best way to fix these things.
Absolutely, they come in, they bring refrigerators, they bring ranges to the hotel where we have the conferences, and we actually break them down, learn how to fix them, go over, issues that every one of them is having, and teaching. It's a wonderful time for them to connect with the engineers, the trainers, and the executives too. They all
amazing.
Show up. Yes.
Yeah, that really is amazing. So that's interesting here. So they actually physically get to go through and do these things, and you have 600 people at this thing?
We do.
Yeah.
And that's a small conference. A lot of people don't know. There are, I think from the numbers that I have heard, 40,000 appliance repair companies across the nation, and we haven't even touched the surface of all of them coming. And I'll tell you a funny story. My husband and I run the business together, and I didn't want to go to the conference the first time because I said, no one's going to teach me how to run my business. I'm doing just fine.
And I love the confidence, John.
Debbie's very confident.
I can tell. And very successful.
I did not need someone telling me how to run my company, but I learned so much. We all have the same problems. We're all running a business, and we all network together and give each other ideas. And one idea can change the future of my company tomorrow. And so we all need to get together. We're supported. It's a support network as well. And now I have friends that I call when I see a problem. Are you seeing the same problem across the nation? And so we use each other for support, for education, and to grow our businesses.
So do the manufacturers, and I asked this question for a reason, do the manufacturers, when somebody calls, like for instance, we have an outdoor fireplace and the thing was giving me fits on our deck, and I'm trying to find appliance repair people to fix it, and I'm not getting anywhere. So I called the company itself, and they said, well, we have certain people we train.
Correct.
So that's the kind of thing and so the guy came out.
Absolutely what we
and
do.
The thing works like a charm. I could not be happier with it. And then he went and fixed the one in the living room to make it work better than it had worked. Mm-hmm. But you could call all kinds of fireplace people, and they didn't know beans from apple butter about this particular fireplace. But the manufacturer sends this one group out, and the guy did the whole thing, and it did a beautiful job. So that's basically an illustration of what you're talking about. Right? Thermador comes out with a brand new oven and a brand new range top, and it's got all these different opportunities. And how do you fix it? Okay, if you're the independent guy out there that doesn't belong to this association or doesn't do that kind of education, you don't know that.
That's correct. So we become an authorized service provider for all of the major manufacturers, and we actually get introduced at some of these conferences. So we work directly with them.
So that's interesting. They have a designation that makes you an authorized service provider for these particular appliances.
We can. That's where, when I became a Bosch authorized service provider, I met them, the regional service manager at the United Appliance Servicers Association. That's where that interaction happened, and then we started the training. Before that time, I was getting the training at this association. The people that I brought with me were getting the training through United Appliance Servicers Association because Bosch was there training. They'll train everyone, even the people that are not authorized, so that you can be better. Bosch wants the best people working on their product.
That's their name on that appliance.
Right.
So it probably helps to have somebody who knows what the hell they're doing.
Absolutely.
Yeah. If you want to reach out to Debbie, either of her companies, the one in Oklahoma and Texas is d3sservice.com, d3sservice.com. In the southeastern United States, that'd be in the Carolinas, etc., you can reach out to her at sloanappliance.com. That's sloanappliance.com. Like I said, if you're an independent repairman out there and you're looking for a home, this might be a good place to look. And if you're looking for repairs, I think these folks know what they're doing. Go to our website and check it out. Stay right there. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. Don't go anywhere. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. In fact, we have another new affiliate we want to announce today. This is WRHI AM and FM 100.1 in Charlotte, Gastonia, South Carolina. We're pretty happy to have those folks on board. And we really want to say thank you because we're on for 2 hours every Saturday. So 1 to 3, our new affiliate, WRHI. It looks like Dave's going to have a little extra work to do. So we're very happy to have them on board and want to thank them. In studio with me today is Debbie Klintworth and John Kuhlmann. We're here talking about United Appliance Servicers Association, Debbie's company, Sloan Appliance Services, we've talked about in the past. By the way, and while we're on break, I just asked her a question. I said, what does an average salary for these folks make? So they're making between $70,000 and $100,000 a year. You might want to think about that if you're looking for an opportunity. Her websites, by the way, are d3sservice.com. That happens to be in Texas. And in South Carolina, it's sloanappliance.com. So if you want to reach out to her and ask her a little bit about what their company does and why it may be helpful. So let's talk more now about your company, okay? And then how long you've been doing this, and you mentioned Bosch. How many different appliance groups do you service? All the rest of it, and then we'll talk about why John's here. Obviously, to talk about GigCare and how this fits in for you as a company owner. So let's just start with the history of what you do and how you got where you are today.
Well, my husband had a company. And he did the appliance repair. He was the hardest working one-man show until I joined him. Then once I did, we've expanded. We started with just him, and we grew to 2, 3, 4. Next thing you know, we're at 30 techs. And we grew all over the state of Texas. And
you're in the Houston area.
And we were in the Houston area. Our actual office is in Magnolia, which is the outskirts of the Woodlands there in Houston. And we've grown all over Texas, and then we've grown into Oklahoma. So we're in Oklahoma City as well. We have several guys throughout that area. And then we decided to buy Sloan Appliance about 3 years ago, or coming up on 3 years ago.
And that's in Carolina.
And the home base is in Columbia, South Carolina.
Okay.
But we cover all the major cities, Charleston, we're in Augusta, we're in Rock Hill, as well as Greenville.
So you started it out, and now you've got 2 companies working in these areas. What are the plans going forward?
We plan on expanding more and more. We do all major manufacturing brands, all of them.
So you mentioned LS, Bosch, General Electric. What's that high-end version of GE? I can't remember what it's called.
With Monogram.
Monogram, that's the one.
And Cafe.
Yeah.
We work on that. We work on Sub-Zero. We work on some of the smaller brands, LeBaire. We work on, you name it.
So Thermador, all of those.
Gaggenau.
Okay.
All of those. Miele, we cover that. We get training from all the major manufacturers for this to stay. We're an authorized service provider.
So is that a question people should be asking?
Yes.
They call up Joe Blow's Appliance and go, are you an authorized service? Because if they're not, that means maybe they know what they're doing and maybe they don't know what they're doing.
Well, correct. And if you have any appliances that possibly have a part that is going to be under warranty, I'm an authorized service provider, so I will make sure that they cover that part, not you. That's
funny because our house is run on the 4th year that we built this brand new house, and that wine refrigerator that we were talking about, that was out of warranty. But those guys got involved with the manufacturer, and they got them to replace that part without charging us for it. And it was a whole new board of some kind, looked like a computer board that they put in there, and now the thing works like a charm. So it was, but But they're the ones that were able to do that. I would not have been able to do that.
Right.
Yeah, it's pretty interesting. So a little bit about why you thought, with John and Kuhlmann Group that the GigCare 1099 program works for your folks in terms of offering them coverage across the country, because we're the beauty of us and what we do at with PSM Nebraska and with our GigCare program developed through Detego is our rates are universal. So if the rates in South Carolina that you just got hit with by ACA are 40% higher, or if in Texas they're 28% higher, our rates are flat across the country. Our rates were raised 6% this year, right, John?
Right.
Yeah. So talk a little bit about why were you attracted to that?
What I've found is people are afraid of insurance because they don't understand it.
That's 100% correct.
I'm
a 30-year recovering broker, and I can promise you that's an accurate statement. Yeah.
And it's very scary. And at the end of the year, you have spent all of this money on insurance, and what did you truly get from that? If you were healthy, you didn't use it at all, but you feel like you've wasted a lot of money. And so I was looking for an affordable healthcare option for some of the guys that are in the association. Maybe they would have an opportunity if they don't have insurance. Once you get off of your parents' insurance at 26, everyone thinks they're invincible and they don't need health insurance.
Oh, do they ever? Yeah.
Until you need it.
Yeah,
absolutely.
Yeah, until you're in a car wreck or you're playing softball and break your arm. Okay,
right.
Yeah, then oh Lord, I got a problem.
Right.
So we need something that's affordable that people understand so they will use it and not just have it handed to them and they don't know what they're buying. And then they have buyer's remorse at the end of the year because they didn't use it. So I had talked to John about what can we do, what are the options, and what can we bring into the association so everyone can have good health care and they understand what they're actually truly buying. Because not everybody can afford as a small business to provide, very expensive group health care.
No, it's for small companies like yourself, medium to small companies, the pricing is ridiculous because they're tied up in all the ACA regulations. And John, we're not.
Right. We don't have all the extra fees and taxes too that Obamacare built into everybody's health insurance premium. So I've mentioned this before in other shows, but Obamacare, when it went into effect, added about 21 new fees and taxes to all the different insurance programs across the board, be it from small group to large group. So they basically have the carriers and TPAs collect those taxes and turn around and give it to the government. They bill them as premiums. People think they're premiums, but they're actually taxes inside their health insurance premiums. So it drives up the cost, and we don't have that in GigCare.
That's one of the big differences between us and the ACA plans. That plus the fact that we're not making you buy something you don't need. Okay? Like maternity coverage if you're a 25-year-old guy. Probably not going to use that. There's a big difference in the way that works. We have plans that have those things, but we have plans that don't have those things. And that gives people, I like to say a size 44 overcoat doesn't fit everybody. Well, ACA is a 44 overcoat.
Right.
They're trying to make everybody fit. That's part of the problem. The other part is, and I'm guessing before we come out, we're actually coming up on the break. I'll hold this thought till I get back. We come back to the break, I want to talk about what's the age span typically of the people that go into her business, young versus old, etc. And then we'll talk about why this is a good fit for her association and why it's a good fit for associations across the country that might be thinking about what can we do to help our members. Stay tuned. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. We'll be right back. Stay right there. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIE Radio Network. If you have something going on, you need help out there, go to the website, americashealthcareadvocate.com. Send me an email. We are happy to help you in any way we can. We had a gentleman the other day who had a son who was a paraplegic, could not get a wheelchair from United Healthcare because it didn't meet their criteria. Well, we took care of that problem. So if we can help you with something like that, we're happy to do it. The website's americashealthcareadvocate.com. My email's up there. I answer each and every one of them. In studio with me today is Debbie Klintworth. and John Kuhlmann. Debbie is from Sloan Appliance Services. She has 2 different companies, one located in Texas and one located in the Carolinas, and services that whole area. If you want to know more about her, the website for those particular companies are d3sservice.com. That's in Texas. By the way, they're down there in Tyler, Texas, for all you folks in Tyler that I come down and see a couple times a year when I go see Cowboy George. So also Sloan Appliance Service, sloanappliance.com. That particular service is in the Carolinas, so she's happy to help you. And you want to reach out to John Kuhlmann. If you're an association out there and you're looking for a solution for healthcare, this is the man that can help you. He can also help you with 401k and a whole lot of other things. And his website is KuhlmannFin, Fin.com. KuhlmannFin.com. I'll spell it for you. KuhlmannFin, Fin.com. All right, John, let's talk about why this is working. I mean, what do we got? Like 8 associations now you and I are working on?
Yeah, it's close to 1 million lives.
Yeah, so talk about why this is working. And this is like a fever. This is rolling, okay? Talk about why.
The biggest thing, I think, is as everybody's heard about on the news, the ACA subsidies have been reduced by 40%. And then, we've talked about how it's the perfect storm, unfortunately. The carriers are raising their rates dramatically, and they also some have pulled out of the market. Aetna lost $2 billion last year, and because of that, they decided to pull out of the ACA market and dropped 1.1 million people off their individual plans that they used to cover. It's really because when the government took over with the ACA, they basically wanted to take over healthcare, but they didn't do anything to make healthcare better. And the program's just not working. It's not about that the subsidies are going away so much as it is the program didn't do anything to fix the problems with healthcare. GigCare does that. So GigCare does things on the PBM side. I'll let you talk about that more extensively about it, Carrie, but they do great things on that most of the AC carriers don't do. And it's really much better for the members. They can get specialty meds a lot of times at low cost or no cost, whereas if you're on an ACA plan, you literally have to pay most or all of your out-of-pocket to cover your ACA med, things like that.
So, Debbie, what do you think this does for the association as far as their ability to attract new members and also their ability to retain the people there because they're offering a health benefits plan that nobody else is offering?
It is helping people have a peace of mind and offering something not only to themselves, but also their employees or their 1099 employees that they can't afford. And it is so worthwhile. I know that I have a personal issue way back before Obamacare, where my son was so sick and they kept saying I had a pre-existing condition and I couldn't get him insurance. And he ended up having a hole in his heart that wasn't diagnosed till he was 8 because they wouldn't run the tests. So that's another reason why I have gotten involved in this, because people think they can just skate by and the government will take on their health benefits. But I can show, yes.
Oh, yeah. Uh-huh.
They really do. They're going to treat me, but they only treat emergencies, and my son, to me, it was an emergency.
Of course it was.
But because I didn't have insurance, he didn't get the treatment that he deserved. No matter how much they wouldn't do it because I had some money, but the hospitals knew I didn't have enough money to cover it just in case. And so everyone needs to be covered. You cannot rely on the emergency situation where the emergency room is going to treat you and you're going to be okay. Yep. It's not like that. No, and this is real insurance. You just need to understand what it does for you and how it's going to help you. And as far as the money goes, it's affordable.
It is affordable. We're a lot more affordable than ACA is, okay? Question to you. How many people between the ages of, say, 21 and, let's say, 40 in your company, what percentage of that is the repair people in your company?
Most of the people that work for me are under 60 and above 26.
Okay. All right, so that's a demographic. And in those demographics, John, for instance, you get up into the 45, 50, we're less than half. Right. What ACA is. The other thing is, and I asked you this on break, you have guys that live in rural communities who come in to work in the cities to do appliance repair. Maybe they live out in the country, they got 10 acres or something, and they don't want to live in the city, but they're guys that are hands-on guys, they're good repairmen. The problem with the ACA and Obamacare plans is most of the major carriers, all of them use narrow networks. And by narrow networks, I mean they confine the number of providers you're going to get. And those providers, John, are usually centered around large cities or communities,
right,
like Columbia, South Carolina, like Tyler, Texas. But if you live in Jackson, Texas, you're not going to have coverage, which means you're going to drive 45 miles to get over to Tyler,
right,
okay, to go see your doctor, okay? Or if you've got an urgent care, you get to drive 45 miles to the closest urgent care versus the way we do it, where you have the Aetna PPO network,
right,
you have the Blue Cross and Blue Shield PPO network in Nebraska, okay, and you also have the Aetna EPO network, which is lower cost, but it keeps you're confined to the network, which the Aetna network's second largest in the country behind United. But the point is, they've got access wherever they are. They don't have to drive 50 miles if they're in Jackson, Texas, because Aetna has got a provider in that community. That's the way that it works. How important is that to you when you're looking to recruit or get people to come to? Because the number two thing they ask, tell me if I'm wrong, after what am I getting paid, is what are the benefits?
Absolutely.
Okay.
Well, and we want to provide a benefit where they're not going to be in such a small network that they're going to have to wait 8 months to see a doctor too.
Yeah.
That is a big problem.
Well, it's huge. Yeah. So, John, talk a little bit about, how you see the associations, now we're seeing all this interest from the associations.
Right.
In why does this fit for them? Why did they want to do this?
Well, I think the big thing is like with the UASA, a lot of their members are small companies and they can't afford to provide group benefits to their employees. Also, a lot of them have 1099 workers. They're not W-2. So the GigCare fills that gap and need. And then they can tell them, yeah, we have a program. They share it with them. Then the member can call into an enrollment center and talk to them about signing up. Getting back to what you talked about, we had a member sign up in Florida. It was a husband and a wife. They're like 62. Their rate was going to be $2,700 a month on the ACA. That's what it was going up to. That's a house payment, right?
Yeah.
And GigCare was $1,390, and they obtained better coverage too with the Aetna network. So really a great program and a big win for them. So that's really it. The big thing is the association members, companies, a lot of them just can't afford to offer it. And this gives them the need. In addition to that, when they call into the enrollment center, they'll also be offered dental and vision and life if they would like, and other ancillary coverages.
Yeah, so they're getting the full package.
Complete benefits package.
Yeah. And the experience your members have had has been a good experience up to this point?
Yes, we are working through that. It's education to teach them what the insurance is providing.
Correct.
Because a lot of people are just scared. It's different.
Oh, yeah.
They don't know the acronyms that everyone's using.
Right.
And it's just about education. And once we get through that, I think it's going to be taking off. And more people are going to be buying.
Yeah. So you're listening out there. You belong to an association. Maybe you're a director in an association. You're thinking maybe this is a fit for us. Well, you're not going to know if you don't reach out and talk to somebody. The guy you need to talk to is sitting right here. You need to talk to John Kuhlmann. You can reach out to him at KuhlmannFin.com. I'm going to spell it out. KUHLMANN Fin.com. He'll be happy to talk to you. He's working with a lot of associations. He's got a lot of success behind what he does, and it's a very professional group. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. Stay right there. We'll be right back right after the break. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. Now, look, you're listening to this and maybe you work for an appliance repair service and you're like, we really need to get involved with this association, okay? Well, you can do that, all right? But you need to go listen, tell your boss, your partner, whoever it is, go listen to the podcast or go up and look at the YouTube broadcast, America's Healthcare Advocate, okay? And then they'll understand everything we're talking about here today and why this might be a benefit, why what Debbie is explaining might be really important to you. So again, go up on any of the 16 podcast platforms or on our YouTube platform, and it's all up there. John, let's talk about a little bit about what separates GigCare. Population Science Management owns the program. It was developed as GigCare under the company Detego, which is our primary company. But when we did this intentionally, when we wrote this to be very, very different than ACA. We're not governed by the Department of Insurance in these states. We're governed by ERISA. We're governed by the Department of Labor. There are federal guidelines that we qualify for with this plan. So we don't have to comply with a lot of, I'll just call it nonsense, that ACA makes you comply with. So let's talk a little bit about what some of those things you see that make us different.
The first thing I wanted to say, too, is a lot of people are, they're used to what they're used to. So they just kind of want to continue on with the same thing with the ACA. But the ACA is crumbling. And it's falling apart. And GigCare is definitely a great solution, an alternative to look at to do. One of the things we do is on the PBM side, I believe it's the pharmacy side.
Yep.
To keep it in plain English.
Script aid.
Yeah. We basically go out and find those drugs at a very low cost or no cost for the members. If you're on an ACA plan, those are most of the large insurance carriers. They're all publicly traded. They're doing all they can basically to get as many rebates as much as they can on the drugs, not to lower the cost of the drug and the medication. So GigCare does the opposite. They get the drug at the lowest price that they can possibly get it at and try to transfer that over to the member. They've also added Mark Cuban's Cost Plus drug program. It's a wonderful program. I'm forgetting the name of the drug. I believe it's like $14,500 a month. And Mark provides the drug for $400 a month. Yeah. So it's a wonderful, wonderful program.
Yeah. So we have a drug importation program. And so what that drug importation program does, if you take a medication that's ridiculously expensive, and we go back to when the weight loss drugs first came out, and if you wanted to buy it and you weren't a type 2 diabetic, it was $1,100. Well, we brought it in from Canada for $89. So this is the kind of thing we can do. The ACA plans are precluded. They cannot do that. We can, okay? We also have a foundational assistance program, which is a little bit of what John was talking about. By the way, all the work to apply for that medication and get it from out of Canada, New Zealand, Australia, we do it. Our nurses do it at Detego, at GigCare. That's their job, okay? And for foundational assistance, you have a kid, let's say, that needs growth hormones. You come on the plan a year later, doctor says your child needs a growth hormone. That's $100,000 a year. Okay. We can get you foundational assistance where we do all the paperwork. We file it, we get the med, and we get it sent to you at no cost or at a very low cost if you qualify. And almost 90% of the people qualify because not everybody can write a check for $100,000.
Exactly.
So those are some of the differences. Yeah. And that rebate thing is just a quick. What you're telling them there is that the carriers are getting rebates from the drug companies that they're never seeing.
Right.
We're transparent PBM. We do not take rebates. Rebates go right back into the cost of the med, which is what you're talking about.
Exactly. So you take the drug Humira, everybody sees it advertised on TV. It's typically around $7,000 to $8,000 a month. There's different versions of it, but a lot of the large insurance carriers that are publicly traded, they say they get the drug for around $4,500 to $5,000 a month. GigCare typically can get that drug for about $2,500 a month.
That's right. Yeah.
Because they don't take the rebate. So what that tells you is the large insurance carriers are all keeping that rebate. Well, if it's a $2,500 difference per month, it's $30,000 a year that they're pocketing off of every person that takes that drug. That's just one medication. GigCare doesn't do that. And that's why they're able to drive the value they do and bring the cost down. I think another good thing to talk about would be the green imaging program.
And that's really unique. There's all the ACA plans out there, Debbie. If you need an MRI, CAT scan, or which is a major expense, you're looking $3,000 to $5,000 to $6,000. You get it done in a hospital, it's going to be $6,000. You pay the deductible, you pay the coinsurance, and you pay a copay. So you're walking out the door, let's say you've got a $3,000 deductible and out-of-pocket max for another $5,000. Basically, you're paying for the whole damn thing, all right? They give you a network discount. You're still paying for the whole thing. Under our program, John's referring to the green imaging program, we give you a voucher. And there are independent centers all over the country that these folks are contracted with. You go in and you pay nothing. There's no copay, there's no deductible, and there's no coinsurance. Well, the ACA plans don't. Now, they could do that. They're not precluded from doing that. but they're making money off that.
Right.
Okay. So they're not, they're making money off that. There's a reason that they're doing it. Okay. So those are some of the things I think that do make us very different. Yeah. In terms of what we do and the way we do it. And if you've got a provider, this is interesting when you brought that up about your son, if we had that situation, and we go to Aetna, and Aetna says, well, no, this doesn't meet the criteria to cover it. We're going to appeal that. You're not going to appeal it. We are. Okay. And we're going to appeal up the process until we get it approved. Or we do a direct contract with that hospital that says, okay, here's the deal. We're going to pay you 130% above Medicare to do this procedure. Boom. We want the procedure done, period. Okay. And 90% of the hospitals will agree to that. There are some that don't, but the majority of them will. But it all comes down to advocacy, John.
Right.
We've got a whole team of people that's what they do.
Right.
Tracy Krause in our organization, she does a fabulous job. Brandy Bornson does exactly the same thing. If the broker's got a problem, if the member's got a problem, we're there to fix that problem.
Right. I think another thing to add too is that with GigCare, there's well over 100,000 members on the plan.
147,000 total.
So when GigCare is representing you to get these things done, it's not you, one little person going to Aetna. It's GigCare.
Yeah,
so
we're the advocate.
Things get done.
Yeah.
And usually there's not problems anyway, but things, if are needed, they get done.
Things happen. People have claims issues. I had a claim kickback for $1,000 the other day, and I get a letter from some anonymous physician service. First, I think it's a scam. It's not. And for some reason, it got kicked out. Well, I have a med sup plan. I don't have any copay, so I don't have any deductible. And they didn't know that I knew that. Well, I made it very clear that I did. And I said, I'm appealing this now, so don't make an issue out of this. And I gave it to my broker, Carol Lee Steele, who I talk about every week on this show.
Yeah.
And she went in and knocked it down, and I'm not going to pay a dime of that. But you've got to have an advocate.
Right.
That's the way it works. Well, thank you both for doing this.
Yeah.
Okay. Thank you.
Yeah,
thank you for having us, Gary.
Thank you for having us.
It was just great. It was wonderful to have you come up and tell your story. It's wonderful to hear somebody start a small business, be successful at it, and obviously you're very successful at what you do. So congratulations.
She's only getting started. So
Yeah, you're probably right if I had to guess.
Debbie's a ball of fire.
Once again, I do these shows that this is about education. This is about teaching you opportunities that are out there for health benefits. In this particular case, if you're an association, this is a way to find a solution for your members that might make a big difference for you. Get a hold of John Kuhlmann. You can get a hold of him at KuhlmannFin.com. I'm going to spell it KuhlmannFin.com. He'll be happy to help you. And now I leave you with this thought from Albert Einstein. The one who follows the crowd will usually get no further than the crowd. The one who walks alone is likely to find himself in places no one has ever been. Remember, friends, it's a funny thing about life. If you refuse to accept anything but the very best, you most often get it. Thank you for listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA, here on the HIA Radio Network. Goodbye, America.